Good evening, ladies and gentlemen, and a very warm welcome to all of you. Give me a minute to just check. I think we are doing the recording. Yes, we are doing the recording. So, on behalf of JMitra and Company Private Limited, I am delighted to welcome you today's session in our JMitra Scientific Webinar Series. We deeply value your time and your commitment to staying informed on cutting-edge innovations in healthcare and diagnostics. Well, today's webinar addresses a very timely and a critically important question, something which is radically new for the Indian subcontinent, in fact, for the world at large, the home test for dengue, an idea whose time has come. Well, as the country grapples with seasonal spikes in fevers and overloaded healthcare systems, the ability to detect dengue at home early and reliably could be a true game changer. So, this session, we aim to explore the scientific, clinical, and even public health implications of introducing a home based dengue diagnostic tool in India. It is now my absolute honor to introduce our distinguished speaker for the day, Professor Ashok Rattan. Professor Rattan is one of India's most respected microbiologists and thought leaders in infectious disease diagnostics. He's a Commonwealth Fellow, an INSA DFG Fellow, and has been guiding force in shaping diagnostic strategies both in India and globally. Well, with decades of academic, clinical, and industry experience, he brings unparalleled insight into the evolving landscape of point-of-care and home-based diagnostics. Well, please join me, everybody, in welcoming Professor Ashok Rattan as he takes us through this fascinating subject. So, with that, I would hand over the forum to you. Sir, I will control the slides from here. Please let me know when you want me to shift.
Yeah,
You, sir.
we can go to the slideshow mode. Next slide, please. Monsoon brings relief from heat and it brings great joy to the children. Next slide, please. But there's also increased risk of mosquitoes and flooding, as you have seen in the recent past. Next slide, please. When you wade through water while going to school or office, you are at increased risk of picking up Leptospira from the contaminated water. This is more in South and in Mumbai than in North, probably because the North soil is acidic, so Leptospira doesn't seem to survive too long, but otherwise water is teeming with Leptospira, which are excreted from rodents' urine or cow's urine or dogs or pigs' urine. And as we wade through water, we pick up Leptospira, which can infect intact skin. Next slide, please. But we'll discuss this some other day. Today, we will focus on mosquitoes. There are many types of mosquitoes. What we are focusing today is on mosquito which breed in fresh water. They are also known as tiger mosquitoes, not that they come from our neighboring country, but because their body has stripes, as you see on the left side. And when you see them sitting, you would find that their body is parallel to the ground. On the other hand, Anopheles mosquito, which transmit malaria, sits at an angle. So angle and Anopheles and Aedes is parallel. This mosquito breeds in fresh water. So the rain will get water all over the place And if we are careless in leaving pots which are empty, or tires which have been thrown away, or cans which have been discarded, or not draining out our desert cooler, then the mosquito will grow and breed in it, and then soon it will start transmitting infection. Next slide, please. Because there's change of season, there's also a spike in number of acute fever cases. Of households reported at least one member with high fever. Pediatricians are seeing 10 to 20 cases per day of high-grade fever in children, often with cough, sore throat, and fatigue. But children are not the only one affected. You would find adults and senior citizens also bearing the brunt. Next slide, please. Indian Association of Critical Care in 2014 had a conference, and they wanted to deal with the causes of fever, especially tropical fever, and they said that fever during the monsoon can be of 5 types. One is undifferentiated acute fever. Second is fever with rash or thrombocytopenia. Third is fever with acute respiratory with encephalopathy. Fifth is fever with multi-organ dysfunctional syndrome. Today, we are concentrating on the first one, that is undifferentiated acute fever. There is sudden onset of high-grade fever, and this is characterized by any of these 6 infections: dengue, malaria, typhoid, leptospira, scrub typhus, or chikungunya. Next slide, please. In the world, it has been suggested that in 2024, there were 14.1 million, there were 9,404 dengue-related deaths. And dengue fatalities were 5 times higher in the southern than the northern hemisphere. There is no specific treatment for dengue or severe dengue, but early detection and access to proper medical care lowers the fatality rate from 20% to less than 1%. Next slide, please. In India, from early days, there's been an increase in the number of dengue cases. While the world has seen dengue, in India, dengue is now found in many places which it was not present earlier. The time in North India is immediately following monsoon, and that means in July and August, as you see here. But I was told in the South, it is available throughout the year. Next slide, please. Is an RNA virus. It belongs to the member Flaviviridae, and it is single-stranded positive strand RNA virus. It has 4 serotypes, and the size of the virus is 40 to 60 nanometers. It is composed, the genome is composed of one fragment, RNA fragment, which is positive stranded, and it produces is 11 kilobase in size, and it produces one polypeptide, which has 3 structural proteins and 7 non-structural proteins. Each of the non-structural protein have been assigned different functions. It is NS1, which is a solid, thus the plasma, and is present in the blood and is normally detected. I would describe more about NS1 subsequently. Next slide, please. The clinical features of dengue. Dengue is a dynamic disease. It has 3 features, 3 phases. First phase is febrile phase. So one moment you're healthy, second moment or soon you have acute fever. So there's sudden onset of fever, vomiting, rash, diarrhea. This is the febrile phase, which lasts for about 4 to 5 days. Subsequently, there is a phase when the fever comes down, and normally we would think that we are becoming better. But now we are entering a stage where most complications occur. There is hypotension, there could be pleural effusion, could be ascites when person's life is lost. If we survive through these 3 or 4 days, we go into a phase which is known as recovery phase, which lasts for some time, but subsequently, once we've recovered from it, we get lifelong immunity from reinfection from that virus, that serotype of virus. But we are still susceptible to the other 3 serotypes of dengue virus. So that means in one lifetime, we have potential of suffering from 4 dengue infections. Next slide, please. So the primary infection normally could be mild or asymptomatic. As I mentioned here, primary is once. Secondary could be 3 times more. So the first one, when we have primary infection, it is mild and maybe completely asymptomatic. Next slide. Is the secondary infection, which may, not necessarily all, but there is risk of serious infection or even death during secondary infection. I hope there have been some reports of severe infection in primary condition also. Next slide, please. So at this moment, we feel that our understanding is that for a mild infection, it is the second infection which could have serious disease manifestation and associated with fatality. And here we have a concept of antibody-dependent enhancement in this case. While against the homologous virus, there is 100% protection. Against the heterologous 3 viruses, there are incomplete and non-neutralizing antibodies, which can cause damage. Next slide. As you would see here, this indicates the cell. It enters the cell, it multiplies in the cell, and then it also stimulates the body responds by producing B cells. The B cells respond by producing antibodies which will neutralize it. This neutralized antibodies would then be engulfed by macrophages and monocytes and removed. This is how the protection occurs, and that is how we recover from the primary infection. Antibodies provide lifelong immunity against the infecting serotype. Protection against other 3 serotypes is transient, and in fact, non-neutralizing antibodies are produced. Next, please. Once that happens, you would find that instead of neutralizing the virus, the memory cells which will remain from the first infection would now bind to the virus. But now, instead of being neutralized, they'll be engulfed into the macrophages, and macrophages will allow the virus to multiply substantially higher. As a consequence, a high concentration of the virus occurs in secondary infection. Next slide, please. And this then
leaks from blood vessels into the surrounding tissue. Plasma leakage is the most serious complication that distinguishes dengue from severe dengue. For some dengue patients, as fever begins to disappear, severe dengue will develop.
So you'll find here that NS1 is binding to toll-like receptors. These receptors will lead to release of cytokines, and so there may be a cytokine storm, and NS1 has direct damage to the epithelial lining and the tight junctions. As a consequence, it leads to plasma leakage. The plasma leakage is the one which occurs after 4 or 5 days when the fever has decreased. And this is where shock can occur, or if NS1 is sitting on the platelets, then the antibodies will help destroy the platelets. As a consequence, there is decrease in platelets leading to hemorrhage. So the toxicity or severity is caused by the amount of NS1 or amount of virus that is present and the presence of non-neutralizing antibodies. Next slide, please.
Plasma leakage is a process in which the protein-rich fluid component of the blood leaks from blood vessels into the surrounding.
There is a paper from Indonesia which says that there is a correlation of the presence of non-structural 1 antigen dengue virus with severity of dengue infection. In this, as they indicate that they had 80 persons, 60 of them had NS1 positive, 20 of when they found that if NS1 is negative, then there is no thrombocytopenia. But when NS1 is positive, then there would be some which would have thrombocytopenia and others who would not have. And thrombocytopenia is present only when NS1 is present. So they feel that the higher the amount of NS1, the more is the chances of thrombocytopenia. Next slide, please. In a study performed in Patna, it was noticed that dengue was the most frequent cause of acute febrile illness during monsoon and post-monsoon period in Indira Gandhi Institute in Patna. You notice that dengue was the commonest disease. Next slide, please. In Maharashtra too, you would find that acute febrile illness, the commonest cause of acute febrile illness was dengue. Next slide, please. So overall, it is emerging that all over India, dengue is the commonest cause of acute febrile illness. In Delhi too, it's been found in most of the districts of Delhi, and there have been frequent spikes. Next slide, please. There was a global burden of disease study, which indicates that between 1990 and 2019, the prevalence of dengue has increased from 0.9 per 100,000 population to 1.6 per 100,000 population, an increase of about 40%. There's also been increase in number of hours that are lost or days that are disability adjusted life years. 16.444 years, it's 27.992 years, which has been lost as a consequence of dengue. Next slide, please. So I guess now we are in agreement that as the monsoons arrive, within a few weeks, there would be a big spike in fever. But all hospitals have a long queue, and wherever you go, you have to wait in line. So when you're sick, you wish there was a test which was available. Next slide, please. Which you could perform at home. Just as when you have diabetes, you monitor yourself, you monitor your sugar frequently by testing for the presence of sugar, or when you suspect that you might be pregnant, you can do the tests at home in the privacy of the home. The advantages, you can do it anytime that you want. You can do it as frequently as you want and at your convenience. This is what a home testing offers. Next slide. So because of the conditions that are there, what you're looking for is a hassle-free test, which gives you fast results in 20 minutes or so, which is easy to perform so that there is no sample preparation and the results are available. It should be reliable and it should take minimal sample so that even children can be tested easily. And the format that you're looking for is lateral flow, where you put one drop in the S, you put the sample, wait for 20 minutes, and see whether one line has developed or two lines have developed. Next slide, please. This is known as the lateral flow card test, where the sample is placed and the results are with test line and control lines or only control lines. Next slide, please. So home test could be of three types. One is self-test. This is what we are talking today. Self-test is when the entire process from sample collection to result interpretation is done at home and by you. Examples, as already mentioned, are pregnancy test and sugar test that you have been already performing, and you would recall that during COVID time, because the labs were taking a long time since they were overworked, you started doing rapid test, home test, self-test. There's also home test when you collect the samples, but somebody comes home to pick up the sample. And the third home test is when you book your time with the lab or the clinic, and then after you've made the arrangement, you drive down to the clinic, get the sample taken, and get the results at home. But today we are focusing on self-test, where you are doing the test yourself. But other elements will also come into the picture when you consult the doctor. Next slide, please. So the advantage is convenience and accessibility. You can do it in privacy with confidentiality, time and cost efficient, empowerment and self-management. And because many of them would have filtered during the test itself so that there'll be reduced burden at the clinics and in the hospitals. The contradictory part is that you are worried about the accuracy and the reliability. You're worried that you might make a mistake in interpretation, or sometimes the interpretation is not clear. Then what to do when it is positive? And if the test is unreliable, then it might lead to increased healthcare utilization due to wrong results. So those are the pros and cons that you have to keep in mind. Next slide, please. So first is you must be convinced that it is worth your while to know whether the fever that you have is because of dengue or not. First reason is that clinical management hinges on the result. Dengue requires specific supportive care, especially fluid management, to prevent shock from plasma leakage. Misdiagnosis it as a bacterial infection would lead to unnecessary antibiotic use, which won't help the cause and may increase in the burden of antibiotic resistance that India is famous for. Then it's also when you have fever, NSAIDs like ibuprofen are commonly used for fever. But in dengue, they increase bleeding risk. Same is the case with aspirin. So both ibuprofen and aspirin must be avoided. Early detection can save lives because severe dengue can escalate within hours. Early diagnosis allows for close monitoring of warning signs like low platelets, bleeding, or abdominal pain. Timely care can reduce mortality from 20% to less than 1%. So it is essential to know whether the fever that you have is dengue or not. There are additional benefits. Next slide, please. This will help you differentiate between other causes of acute febrile illness like malaria, chikungunya, typhoid, leptospira, and even COVID. Confirming that you are suffering from dengue helps rule out other causes and avoids mismanagement. There should also be public health response. Whenever there's cluster of dengue in a society, that would mean that vector control measures like fogging, larvicidal spraying, and community alerts must also set in. It will help track outbreaks, allocate resources, and prevent further transmission. There's also economic and social impact. Early diagnosis reduces visits to the hospital, hospitalization time, work absenteeism, and healthcare cost. It also minimizes community spread, especially in high-density urban areas like Delhi NCR. So these are the benefits why it's best to know soon that the fever that is prevalent, is it because of dengue or not? Next slide, please. Of course, not every point of care testing can be done at home, and that's why CDSCO oversees the approval and safety of home tests, and the test that we'll be describing has approval for being used in the house. I would like to state it very clearly that home self-test should not be viewed. It should be viewed as the first stage in the diagnosis cascade and not as a replacement of consulting a doctor. Next slide, please. One question that you must be clear about is, can you diagnose dengue on the basis of clinical symptoms? Clinical symptoms, the short answer to that is no. You cannot make a clinical diagnosis of dengue fever because there are non-specific symptoms like fever, headache, muscle ache, rash, which is common not only in dengue, but also in chikungunya, in malaria, in typhoid, leptospira, and scrub typhus. So warning signs may appear late or not at all. And so misdiagnosis could lead to giving ibuprofen for decreasing fever or aspirin. That is why both WHO and CDC, the guidance from every health authority is that clinical signs must be supported by lab confirmation, especially in areas where multiple febrile illnesses circulate. That is like India. Next slide, please. So once you're convinced that yes, there is a need to know whether you have dengue or not, and that clinical symptoms are not sufficient, next step is what lab test to do. There are various parameters which, as I said, that dengue is a dynamic disease. There are various parameters that need to be used. One is that once the illness starts, because it's caused by a virus, the virus is present for about 1 day or 2 days before the illness starts. So virus is at the peak when the person starts responding by fever. As antibodies start building up, the viremia comes down and antibodies appear. But antibodies will appear after a gap of 4 to 5 days. Since NS1 is made by the virus, as the virus multiplies, NS1 will also multiply. And since NS1 is a protein produced by the virus, once the virus is cleared, NS1 may still be present for some more time. But so you have a choice in early diagnosis. You have a choice of either detecting the virus or detecting its surrogate, that is NS1. Subsequently, after 5 days or so, you have a choice of looking for antibodies. But this indicates how the virus acts and how the body responds. At the same time, the danger is because the plates, in a normal course, you must do your CBC, that means complete blood count, and monitor the number of platelets throughout the illness. Along with platelets, whether there's capillary leakage could be monitored by doing the packed cell volume. So packed cell volume and platelets are something that has to be monitored during the course of illness. Next slide, please. So you would do this if you suspect dengue, and as I told you, that these are the symptoms which would, and you have acute fever. Acute fever without any localizing sign, the first you should suspect dengue. Next, please. So this is just a demarcation of the time scale that the mosquito has bitten. After a week of the mosquito bite, you have high fever, and before the fever, there is virus can be found. Then as the virus multiplies, it reaches a high level and you have fever. At that time, NS1 will be also found in high quality, and about in 3 to 4 days time to 5 days time, antibodies will start appearing, and IgM is the type of antibodies that will indicate that you want to be careful and you want to know if you have dengue fever during the febrile stage. You don't want to wait for the critical phase to be there so that you don't have to be rushed to the ICU. It's better whether this fever is because of dengue or not. Next slide, please. And as I said, you can and 3 secondary infections, and the parameters are slightly different for the primary infection and the secondary infections. Next slide, please. So these are again listing out the benefits of knowing that you have dengue infection early in early during fever that you have. Next slide, please. So let's now go through the attributes of the diagnostic tests before you're convinced that home testing with NS1 is the best option that you have. The first test is RT-PCR, reverse transcriptase polymerase chain reaction, which you would have heard during COVID time. It's present from -1 day to about 5 to 7 days. So it is present during the acute febrile illness. It detects the virus, and once you have detected the viral RNA, you can also identify which serotype you are suffering. And so if you do this, and you would know whether there's serotype 1, 2, 3, or 4. And as I said, if you have suffered from serotype 1 once, you would be protected against serotype 1 throughout your life, but you're susceptible to serotype 2, 3, and 4, and so on and so forth. So it is highly specific, it's highly sensitive, it's also known as the gold standard for early diagnosis. But it is costly and it is present only in the first week. So if 1 week has passed since you had fever, then it's likely to be negative. On the other hand, NS1 antigen, and of course, RT-PCR, as you noticed, is in COVID's time also, it is much more costlier than any other test that you have. NS1 antigen, on the other hand, also has the same dynamics as RT-PCR, since it's a product of the virus. It's an antigen product of the virus. It's secreted is present in the blood, is present in plasma, is present in the serum, is present in the CSF. It's also been seen in lower titer in saliva and in the urine, and it's present in the fluid that accumulates in the lungs or in the ascitic fluid. So it's present everywhere. It is present for about 9 days in case of primary infection and for 6 days in case of secondary infection. Because in secondary infection, since there'll be pre-existing IgG antibodies, NS1 will combine with IgG and become immune complex, which will be removed. So the titers reached in secondary infection, NS1 will be slightly lower than in primary infection, and it will be detectable for 6 days rather than 9 days as you would get in case of primary infection. But it is detectable, and it can be detected by a rapid test, it can be detected by ELISA, or it can be detected by CLIA, chemiluminescence. It is cheaper, it's easier to perform, self-test is available, and results are available in less than 30 minutes. So while RT-PCR will take 4 hours, this you can get. ELISA, of course, is normally batch tested, while you can get NS1 by rapid test or in 20 minutes time. Next slide, please. The first part, which was initially tested before we went to look for either the virus or NS1, was IgM and IgG antibodies. IgM, as I indicated, appear after 5 days or so and are useful if the fever has been there for 5 to 7 days. If it is too early, then IgM will be negative. while if it is too late, it lasts for about a month or so, or 3 months in some cases. But after that, it becomes negative. So normally, if the patient comes late, then IgM late would mean that after 7 days, then it's not worthwhile doing PCR or NS1. So NS1 is useful for early detection, while IgM will be useful for later detection. On the other hand, CBC, complete blood count, you want to do as soon as you report positive. The first thing that you should do is document what is your platelet levels and what is the packed cell volume. So this is something that you need to do throughout your throughout the sickness. Next slide, please. So the diagnostic strategy would depend upon illness days. That would mean that you have to be clear which day you were healthy and normal, and suddenly there was fever. So that day is important. Take that as day 0. In the first 5 days, NS1 is the practical test that you can do. The ideal test may be RT-PCR. So the gold standard is RT-PCR, but NS1 is a cheaper, faster, and more convenient gold standard. Between 5 and 7 days, that is where the NS1 is decreasing and antibodies are appearing. So maybe both needs to be done. So NS1 or RT-PCR and IgM must be done together. Past, since you had fever, then there is no point in doing PCR or NS1. Then you should do IgM and IgG and CBC. The sensitivity, so once we've agreed that NS1 is the most practical test that you can do for early detection of dengue fever, then the methodology will depend upon whether you want to do self-test, which has a sensitivity of 80 to 100%. It is fast, it is cheaper, it's convenient, but slightly less sensitive than ELISA or CLIA, which have a sensitivity of 90% specificity, or RT-PCR, which has a greater sensitivity and of course 100% specific. And so RT-PCR is the gold standard for viral detection, but the most convenient one among all this will be self-test. Next slide, please.
This is your dengue home test kit. It includes a test device, an assay buffer tube with nozzle, a sample dropper, swab, and a lancet, a disposal bag, and an instructions manual. Rub your fingertip with a swab. Gently prick the fingertip with the lancet. Use the sample dropper to draw the blood into it. Add 1 drop of whole blood sample into the sample well of the test device. Add 1 drop of assay buffer into the same sample well. Allow reaction to occur for 20 minutes and read result. The result is positive when 2 distinct pink lines appear in the control region C and test region T. The result is negative when only 1 pink-colored line appears in the control region C. The result is invalid when neither control line C nor test line T appears, or only line T appears. Repeat the test again with a new card. Dengue NS1 Antigen Self-Test Kit by JMitra and Company, a vision to serve mankind.
So you find that it's a simple test. You have to put just 1 drop of blood followed by 1 drop of the buffer. Wait for in the S slot, which is the sample slot. Wait for 20 minutes. And when you get one line, which is the C line, that means the control line, and it is negative. If you get control line and the T line, that means it's positive. So it's essential for the control line to be present. If the control line is not present, that means there's something gone wrong and the test will be invalid. But you would find that this works very well and it's very easy, clear-cut. Either you have dengue or you don't have dengue. Next slide, please.
This
So I have, over the last 10 minutes or so, I've tried my best to explain why NS1 is required. It's because it's present in high concentration in the first 7 days. And this will help. This is the time when a person has high fever. So it corresponds with from day 0 itself, there is high level of NS1. You can do viremia if you want to do, but otherwise viremia requires RT-PCR, which will require the sample to be sent to the lab. But if you do this test, then you can do this at home as self-test. And just 1 drop of peripheral blood, 1 drop of buffer, and in 20 minutes time, you get clear results. Next slide, please. And all that is required is contained in the kit. So it's high specificity. The strength of NS1 self-test is that it has high specificity, it has good utility, and it has early detection. Limitation is that in the secondary infections, because IgG is already present, so the levels may be lower. And a user may make error, but I think as I explained and showed, and as the video indicated, is just 1 drop of blood followed by 1 drop of buffer. That's all you have to do. And in an experiment which was done in Malaysia, they found that majority of persons who had no training in the lab could do it well. Next slide, please. So the next question is, what do you do if it is testing positive? If it tests positive, you must seek medical attention immediately. This is either by going to the clinic or through telemedicine. I think telemedicine is becoming more and more popular now, but when you have positive, you must seek consultation. And the doctor will then either want to confirm with doing NS1, ELISA, or RT-PCR, and he would like to do CBC to be done so that he can monitor platelets and hematocrit. He would also be able to assist you in identifying warning signs so that if there is severe dengue, he would be able to guide you into coming to the hospital. At the same time, if you're having a mild infection, then you can stay at home. And so once you have ruled out and consulted a doctor, then you can, if you're not suffering from moderate or severe dengue, then you can stay at home. But of course, one is that for fever, you should take only paracetamol and avoid Brufen as well as aspirin. And you should rest while you monitored your symptoms closely. Next slide, please. Remember that in the first few days, dehydration, when you have fever, dehydration is the potential medical emergency, so you must take replacement fluid. Once the fever subsides, then shock and bleeding is the problem that can occur. And that is where you need advice and be forewarned that you have dengue, which can lead to critical phase. And if that is occurring towards that, then it's best that you are in the hospital and not at home. The third part is when you are recovering, then the fluid which has gone into the spaces will come back again. And then also you can have fluid overload. So in case you've had shock or there's bleeding, it's best that you're in the hospital. But once you have dengue, you're pre-warned, and you can then make arrangement in case you are showing signs of either shock or bleeding. Next slide, please. So the doctor will help you decide whether it is mild, which can be managed either in the OPD or at home, or moderate or severe, which must lead you to leave your home and come to the hospital. Next slide, please. And the National Guideline for Clinical Management of Dengue, which was issued by Government of India, have also in 2023 has indicated the things that you need to follow. The basic part is that you should take adequate oral fluids, you should rest, and you should monitor. Next slide, please. And you should maintain this fever symptom tracker, which will indicate which day of fever it is, what is the temperature, whether you have headache, you have body ache, you have nausea, you have fatigue, whether you see any rash, there's bleeding, how much fluid you have taken, and whether there are any symptoms that are there, which will be called as warning signs. Because remember, fever is not the one which is dangerous. Once the fever subsides, that is where the danger lies, and you must monitor this. And you can monitor this only if you are pre-warned, if you have already made the diagnosis that you have dengue fever. Next slide, please. So there's a recovery checklist also. One is to say that you have daily, you're taking 2.5 to 3 liters of fluid. You're resting in a cool, mosquito-free environment. You're taking fever for paracetamol and not ibuprofen or aspirin, and you're avoiding strenuous activity. You're also watching for warning signs, which is severe abdominal pain or tenderness, persistent vomiting, mucosal bleeding, unusual fatigue, restlessness or confusion, or drop in platelet counts. Next slide, please. And WHO in their 2009 booklet had indicated the 4 criteria for dengue hemorrhagic fever or dengue shock syndrome. These are the warning signs that you have to be careful about, and you must, I repeat, you must see the doctor as soon as possible and be admitted if you have any of these warning signs. Next slide, please. WHO also indicates that dengue can exist with warning signs and without warning signs, and so you should be you should be aware when you must not stay at home, especially when you know that you have had dengue, and you must seek admission in the hospital. Next slide, please. Should I inform public health authorities that I have tested positive for dengue fever? The answer is yes. If you inform the public health authorities, this will hopefully trigger vector control. Your report helps local health team launch mosquito control measures like fogging and larvicidal spraying in your area. It will prevent outbreaks and it will support surveillance. Next slide, please. What to do if it is negative? Then you should get tested and the fever continues. Then it could be malaria, it could be typhoid, it could be chikungunya, it could be scrub typhus, and it could be leptospira. All of them are dangerous. So it's best to get them tested either by RT-PCR, which is a multiplex which tests all of them, or one at a time, depending upon what is happening. Next slide, please. You must also understand that NS1 has its limit. You have to remember which day of the test of the fever that you've tested on. And if you've tested too early before fever develops, then it may be negative. And if it is too late, it will be negative. Then additional tests may be required. And of course, I've already clearly explained to you that even if you are either NS1 positive or negative, you must do your CBC also. Next slide, please. And this is where you consider other causes and you should consult your doctor in case you're negative. Next slide. What is the current situation in India? Over 12,000 cases and 6 deaths have been reported as of May, according to NCDC, National Center of Vector-Borne Disease Control, which is monitoring the condition. In 2024, India recorded 2.33 lakhs of dengue cases with 297 deaths. West Bengal, Mumbai, and New Delhi and Jharkhand are the worst regions. Kerala, Karnataka, Tamil Nadu, and Maharashtra have also reported spikes. Next slide, please. Recently, WHO has a website in which, if you look at it, 3.3 million cases of dengue have been reported between Jan and May 2025, out of which 2.7 million are in Brazil. And when you look at India, it's about 18.489 thousand cases. You would find that there is outbreak in Indonesia and in Mexico, and even in USA, some cases are found. Next slide, please. The government's response to this has been that vector surveillance and geotagging of cases should occur. Hospitals should be ready, and they've been asked to add more beds. Platelets should be available, and fogging and awareness campaigns must be held. There was one slide which I'd added later on, which the Chief Minister had a review meeting, and in that it was reported that when they went from house to house, they found 71,000 houses in which the mosquito was breeding. So it is very clear that please don't expect the government to do everything, and each one of us have a duty that we should not have collection of fresh water in any part, because this mosquito lives around us. It can fly only half a kilometer, and it bites during the early morning and at dusk. Next slide, please. So if you are in Delhi, be vigilant and Oh, sorry. This is the one I was repeating. I thought I'd changed the slides, but it's very clear that government will do its job, but each one of us must help in controlling the outbreak if and when it occurs. At this moment, it is under control, but the monsoons have just come. Normally, after 2 weeks of monsoon, dengue outbreak starts. Next slide, please. I think we all are aware that these are the things that we can do. Next slide. So vaccine is under trial, and as soon as by October, I think the results will be out. This is by Panacea with ICMR's help, and maybe vaccine will be useful. But all this will but at the moment, self-testing would be something which will pre-warn you that something can occur, and that will, if you know beforehand and you take appropriate action, that will be prevented. I thank you for your attention.
Thank you very much, Professor Rattan. That was extremely detailed, and a lot of effort had gone into developing this presentation at your end to share with the world at large. So there was a couple of questions that I saw, but mostly very generalist questions around what's the price to the user. I mean, that is a commercial question, and well, it can be taken up at a different platform. But yes, whether it was what is the sensitivity and specificity, and how does the home test compare with the lab test or the PCR? So that was one of the questions that was there on the platform here, sir.
See, of course, PCR would be, say, 95% sensitive and 100% specific. ELISA or CLIA would be 90% sensitive and 97% specific or 100% specific. And this would be one, it would be about, if it is 90 is CLIA and PCR, you would have 80%. Or it depends upon what stage you test. And I think there's indication that the higher the NS1, the more severe it is going to be. So if you're going to miss anything, you'll miss milder infections if they're not timed right. So the critical part is timing. If you time it right, then NS1 will be picked up in biology. It is difficult to say 100% every time. So you have to have that leeway, but it will help you pick up. In majority of cases, it will help you pick up. I think validation has already been done. The in-house validation says 100% sensitivity, 100% specificity. But the more you do, the better we would have the positioning of it. In CDC, they were saying that if you report a negative, you need to do it 3 times. Now, that's not something that we in India can adapt. So we are not advocating that you do 3 times before you say negative. And though if you go to the CDC website, that's what they indicate. But for us, if it is positive, it will help a lot of persons. It will pick up severe cases and it will forewarn you that it is there.
Well, sir, I think the home test is more of an additional tool in the hand of the world at large, in the hands of the general public. That if they were to use a home test, a self-test, it would only help in enabling them. In fact, it will help democratize the entire process of testing, which is the which is where the diagnostics sector is progressing at this point of time. So, thank you very much, sir. And there was one last question where one of our viewers did ask, "Sir, this is a very good lecture. When is your next lecture?" So that is only that's a question that only you can answer. But I was hoping we can do another one next week, sir.
We could deal with ELISA, comparing ELISA with CLIA, because of course, for early we've already discussed that PCR there, but PCR is a lab test which not many persons do because of the cost.
Absolutely.
So in India, the solutions must be cost effective.
Right. So, well, ladies and gentlemen, there you have it. We will do another session, episode 3 of dengue. We'll focus on lab testing around CLIA, ELISA, and new generation techniques for testing in the lab for the dengue and maybe another couple of vector-borne diseases. But you can look forward to that over the next week. Well, same time, same place, and we'll see you then. Thank you, Dr. Rattan. This is a very useful and
Thank you.
informative webinar, sir.
Thank
Good
you.
night, everybody, and have a great weekend. Jai Hind.